in terms of nutrition and the elderly is a very delicate balance. And just like for one example, something we were just talking to her about is like you want to feed the elderly person so they shouldn't become malnourished, but you don't want to overfeed them. You don't want them to become obese. Both ends of the spectrum have their risks in terms of their general health, which we'll get to a little bit more specifically. So it is a very delicate balance in many ways, finding the right nutritional balance in terms of giving food for the elderly parent. And elderly, doesn't have to be a parent, it could be anybody. So I just want to see a nice quote that I found, and it says that food and meal times can be a source of comfort and connection for caregivers and their loved ones. However, it could also be a source of tremendous stress. Okay, so that's the other part of the balance. Meal times, sitting with an elderly person as they're eating, sharing a meal, sharing food, it is a source of comfort. And I always recommend, if you have an elderly parent that you visit or that lives with you, try to eat the meals with them if you're home. Someone should be eating with them. It is food, and food times should be a social interaction. And I find, one of the reasons I think that they asked me to speak is, aside from being a registered dietitian, nutritionist, I do have my elderly mother living with me, thank God, and she's in my house with me, and for like 12 years already. So I do have the experience of taking, Baruch Hashem, so I have the experience of taking care of an elderly parent, and the nutrition part of it. And it can be a source of comfort. It could be a very great source of stress, and we'll talk about that too. So diet, the quality of the diet is very important, and the quality of the diet, the nutritional intake of an elderly person will directly affect their physical condition, very often their cognitive condition, their bone health, their skin health, their immune system. Diet and nutrition is being recognized now as a major source of either like prevention of medicine, or sometimes it needs to be treated with a lot of illnesses need to be treated with diet, and we know that diabetes, high blood pressure, osteoporosis, things even like constipation. These things have to be treated with diet. Actually, that's the first step. Then we go into medicine, into medication. The first venue of treatment for a lot of illnesses is diet. Not all doctors will recognize that, but I think insurance companies will recognize that, because actually I'm a provider for Oxford, and Oxford will pay 100%, no copay, to their members for preventive nutritional counseling for certain diagnoses: obesity, hypertension, cardiovascular disease, diabetes. They want to see nutrition being used as a preventive measure so they don't get on to the next step. And that could really make a very big difference. I've actually had diabetics who went off the medication. They weren't type 1, they were type 2. They lost a significant amount of weight. They needed either less medicine or no medicine. So if you're really careful with diet, we could prevent, or even retroactively, reverse, right? So I'm going to go ahead, reverse a disease. Not always, but very often. So providing an older adult with a proper diet is very challenging. And if you had that challenge, you'll know what I'm talking about, and I'll bring in examples from my own life. So generally, these are all generalizations. As people age, they become less active. Their metabolism slows down, and their calorie requirements decrease, which means they need to eat less. They need fewer calories. Now, this starts at 45 for some of us. I don't know if anybody here noticed that when they got to a certain age, they were eating the same way as always, and then they started to put on weight. Like, it happened to me. And this is not, this shouldn't be happening to you. I'm a nutritionist, but I never really had to watch my calorie intake, and I always ate pretty healthfully. I would take myself a treat once in a while, but you get to a certain age, and I needed a cousin of mine to say to me, Miriam, you can't eat the way you ate when you were 25. It just doesn't work anymore. The same amount of calories you ate when you were 25 and 35, you can eat when you're 45, and when you're 55, and when you're 85 and 95, you need a lot less. And the metabolism certainly slows down. So therefore their calorie requirements decrease, which means they need to eat less. However, because with aging also comes a poorer absorption of food and nutrients, they have higher nutrient requirements than younger people do. They need more vitamin B, they need more, the B vitamins in general, specifically B12. They may need calcium. A lot of them, it could happen in a younger person too, the osteoporosis, calcium, vitamin D. There's certain vitamins that we'll discuss a little bit later on, that they need even more so because their body is not absorbing it from the food. Their intestines are not working as well. Their enzymes that help, metabolize the food are not working as well. And therefore, you can't cut back on foods that they really need for their nutritional, needs. So you have to find that balance. Again, the delicate balance between feeding them enough, not too much, but enough quality foods that they're getting what they need from the foods that you're serving them and that they're eating. Sorry?
Will they be able to absorb supplements as well?
To a degree. In general, like supplements are not not absorbed well as the actual food. Okay, so in general, if you want to get a good source of calcium, you're better off getting it from the food. But if you can't, for whatever reason, or they can't tolerate dairy, or they can't, there could be a medical reason they're not absorbed, then you've got to give them supplements. Will the supplements be absorbed? Hopefully, to a degree. Maybe not as well as someone who's younger, but they'll get something from it. Okay, so we're talking about just briefly that as people age, they become less active, they need less calories, but they need the same amount or more nutrients than they did when they were younger. That's the first challenge. The second challenge is that very often elderly people have a loss of appetite. Okay, they're just not as hungry for many reasons. It could be depression, which comes very often with loss of appetite. It could be an effect of some of the medications they're taking. It could be because they have changes in taste and smell. Very important to know that. I see that with my mother all the time. My mother was never put sugar in her coffee. Never. She would eat it like with a prune, because she was very health conscious. And now she wants 2 and 3 spoonfuls of sugar in her coffee. And she's not, her taste buds have definitely, so she needs things sweeter and saltier. At the same time, okay, it could be a challenge if a person's diabetic, if a person has high blood pressure. You can't give them the salt, you can't give them the sugar. So that's a challenge. Okay, so they lose their appetite, they have changes in taste and smell, and therefore, they may not like, you might prepare them something that they loved in the past, and all of a sudden they say, I don't want this, I don't like this, and it's frustrating. Like, but mommy, you love this, but they don't like it anymore. Changes in taste, loss of interest. Okay. Another challenge that we have is that with aging comes a decline in oral health, okay, and they might lose some teeth, or their teeth might be shaky, and that will definitely affect the way they can chew and, chew and swallow. So there might be swallowing difficulties if someone had a stroke, okay, it definitely affects their swallowing. Some medications affect the ability to swallow. So if that's the case, again, we have to alter their diet in a way that they can tolerate the change. So with chewing, if they're losing teeth, if their dentures are not fitting them properly because they lost weight, okay, that's always an issue that you have to be sure that if they have dentures, it's fitting them properly. Please take them to the dentist. I think at a certain age we just feel like, what are they going to butcher them at the dentist for? They need to go. They need to have their teeth cleaned. They need to see if there's any, at one point my mother stopped chewing on one side. I realized that some of her teeth were loose and she was afraid to chew. We actually had to take them out so that she was not uncomfortable chewing. They need to go to the dentist, and they need to have, be taking care of their teeth, just like us, brushing, flossing, start now, because you need your teeth when you get older. And again, like I said, with the dentures, make sure they fit properly, especially if they lost weight, might end up being loose, and therefore they're not chewing. You have to always look for an underlying reason of why they're not chewing properly. And we're going to discuss what to do with people who have a decline in their chewing and swallowing abilities. Another concern is if they're not living with someone who can help them, and they're on their own, so mobility might be an issue. They may have been able to walk to the store, which was 3 blocks away 5 years ago, but walking becomes harder, the mobility becomes more restricted, and it's hard for them to shop. It's hard for them to prepare their own food. They feel shaky on their feet, they're not cooking. I know with my mother, when she was still home, she would put on the fire and forget that she had it on, and burn things all the time. And I was really afraid that there would be a fire in the house. So, you have to be concerned if they're really able to cook for themselves, physically and mentally, if they can really keep track of what they put in the oven and on the stove, and if it's, if it's okay. And this, again, I mentioned about depression and dementia. They're 2 separate things, but they both cause a loss of appetite. They could cause a loss of appetite. And this is something interesting, too. It's like they might forget to eat. If they have dementia and Alzheimer's, they could forget to eat. Or in my mother's case, it's like she'll just finish a meal sometimes, and we'll go, she'll go into another room and she says, "But I didn't eat lunch." She just finished, but she doesn't remember. Okay, so That's one problem, and a bigger problem possibly is forgetting to eat. They go a whole day without eating and not realize that they're hungry, that they forgot to eat. So these are all the challenges we have with older people, and more. I didn't even bring up the physical conditions, like I touched on, the diabetes, the hypertension, the cardiovascular disease, the stroke, which will all alter their needs and their abilities to take in the nutrients that they really need. Okay, so just a few ways that we can address some of the challenges I brought up. So in terms of like the best way, I think, for an elderly person who has a loss of appetite and for possibly other reasons of poor digestion, again, the digestion slows down, all the functions slow down as you get older. They may not be able to tolerate 3 meals the way we can eat 3 meals. You're better off providing frequent, smaller meals. Okay, 5 times a day. I know it's a little bit harder on the caregiver, but it could be 3 meals and 3 nutritious snacks. We can discuss later what are some ideas, but sometimes you're better off giving them smaller, more frequent meals. They have a chance to digest the food, wait 2 hours, eat again. With a 2.5 hour span in between smaller, frequent meals. Again, it should be visually appealing, just the way you want your food to look nice. Even if they need to have their food pureed, the presentation is very important. Just the way it is for us, it is for them. So, presented, it should be visually appealing. Different colors on the plate, something that's nice. And again, instead of salt, using herbs and spices. Mrs. Dash has a very good, salt. It's a combination already of spices, and that it's low sodium or sodium free even, that you can use instead of salt. And again, of course, we know there's plenty of sugar supplement alternatives out there, if necessary. Okay, I mentioned already about keeping the teeth clean and possible. Okay, again, so if they can't tolerate regular textured food, you might have to cook it with extra gravy. You might have to just soften their food up with a condiment. It could be applesauce, it could be ketchup, it could be something that they like, a soup. Sometimes they just need to have their food softened up for them. Hard foods, raw vegetables might be hard for them. Give them more salads that are, if they can still choose somewhat like a coleslaw consistency, shredding their food, if necessary, chopping it into small pieces, and if necessary, blending. What? Yeah, okay, I can bring it up now so I don't forget. There are, specifically in this area of liquids, but it happens for some solids too, after a stroke or just, again, with age, could be due to medication that they're taking, their swallowing abilities will decrease. Actually, the thinnest, the most difficult food or substance to swallow for a person that has difficulty is liquids, and it's thin liquids. Okay, so water, milk, coffee, tea, these will be the hardest things. The next level would be something like a nectar thick. It will be a little bit easier, but still difficult, and then the next degree would be like something like a honey thick, and then the next degree would be like a pudding, which is almost like a food already. And there are commercial thickeners out there to do it. Now you could do it with, if it's a soup, you could thicken it with, noodles, or some, you could thicken it with something that's homemade, or that you could buy. But if necessary for a liquid, there's something called Thicket or Simply Thick. There are a few different companies that make it. Thick and Easy. And if you notice that the elderly person you're caring for is coughing when they drink, okay, there is a risk of aspiration, okay, meaning that the food or the drink is going down the airway into their lungs instead of going into the esophagus and into the stomach. So that could cause pneumonia. So if you notice that they're coughing while they eat, or that would be usually the sign of it. Sometimes there is a silent aspiration, you won't even notice it, which you can't really do anything about it if you're not noticing it's happening. But if, God forbid, they get pneumonia and they're getting it more than once, you have to have them tested. There's swallow studies that they do using X-ray video fluoroscopies to see where the food is actually going down, is it going into their airway or is it going down into their stomach? So there are definitely things that you can use to thicken the liquids. You would start with, this is really a speech therapist who would evaluate what is the best level of thickening to do for this person. And then food-wise, again, they will tell you, do they need to have their food pureed? Can they tolerate just soft pieces? Again, this is a speech therapist who will be able to help you with that.
How does a speech therapist?
They can watch a person eat and swallow or again through the video fluoroscopy. This is done by a speech pathologist who watches it coming down and see if it's going into the windpipe, into the lungs, and she will be able to tell by giving different textures which food is safe.
It's a special training.
Yeah, specially trained. It's done in hospitals. Just on hospital. NYU has a good one. Columbia has a good one. A lot of hospitals do it. It's basically as good as the speech therapist who's reading the results. And hopefully, I just know that where I work, we deal with NYU and we deal with, I think it's Columbia. They have good speech therapists who perform these swallow studies. If you notice parents depressed, again, this is not my place to say this, but again, from my experience with my mother, and if you think that depression is the thing that's causing them a loss of appetite, do get them help. Okay, an antidepressant, speak to a doctor. Of course, there are downsides to taking an antidepressant. It could make them a little more sluggish and slow, and that has its challenges as well. But sometimes they just need a little something to boost them up, and you'll see their appetite coming back. And that's been my experience. But again, everybody has to judge, for their own person. The other areas, like I know there was some session about, the caregiver that lives far away, the long distance caregiver. I don't know if anybody went there, but if you're not near the person that you're trying to help, there are senior citizens programs that will deliver a good meal a day. Well, if they can go out to a senior citizens program, that's great, and they will get a meal there. It's not always like my father used to go to one of these places, and they give them like a really nice meal, and they have their friends there that they've been spending the whole morning with. It's not always the most medically, supervised meal. It could be salty meat and whatever, but like he enjoyed it. At least they're getting one good meal a day if they can tolerate it. And that's one area, the senior citizens program. Then there's the Meals on Wheels, JASA. They do deliver meals to the house, so that would be another avenue.
Sorry to interrupt. If anybody came on the Brooklyn bus, it's leaving. I don't think anybody did. That's here, but if it did.
Okay, so you just want to then maybe find someone, pay someone to shop for this person, help prepare the meals, even having somebody sit with them while they eat. As I said before, I think the social aspect of eating is very, very important, which is why, unfortunately, I'm going to give you some statistics later, that elderly people living in long-term residential care facilities and nursing home, there's a very high incidence of malnutrition there, and that's primarily if there's, or in a hospital, it could be even worse, because the nurse will come in, the aide will come in, put the tray down, leave. Person might need help. They're not getting the help that they need to feed themselves. They might not be able to open up the covers on the juice, and they'll just leave the plate untouched. The aide will come back, take the tray away completely untouched, and not even say anything to the nurse or to the patient. Why didn't you eat? They don't have the time, they're understaffed, whatever, they don't care, whatever the reason is. So if it comes to the point where somebody's in the hospital or in a long-term care facility, which sometimes is necessary to put somebody there, at least if you can be there at any point during a meal, that would be like very beneficial, to having them complete the meal, and or making sure that, the aide, even if you give them a tip, make sure my mother eats, because otherwise it could be very easily they'll take the tray away and the person didn't touch their meal. I want to also touch upon some other major concerns in the elderly that can definitely affect their health and even become fatal, God forbid. And one thing is dehydration. Okay, so elderly people, again, this is a statistic that I got online, 20% of older people living in residential care facilities are dehydrated, and that figure rose to 40% among those admitted to the hospital. Okay, so dehydration, they're not drinking enough. Now, there are many reasons why this happens, and some of them we can relate to, okay? One of them is toileting concerns, right? An elderly person, it's very hard to go to the bathroom, or if they have incontinence, sometimes even the aide doesn't want to get into much drink. They don't want to deal with taking them to the bathroom or changing their diapers all the time. You have to, so that's a concern. The elderly people are afraid to drink. I know at one point, my mother was supposed to take a water pill. She didn't want to take it because every 10, 20 minutes she had to go to the bathroom. It was just a very big, it was a very big concern. Some of my friend was just telling me that her father used to say, this is for those of you who, know the brachos, 1 shahakol is equal to 3 asher yatzars. And it's true. 1 big drink and you're in the bathroom 3 times. So I know if I'm going in the car for an hour, I will not drink an hour before. That's my concern. So imagine an older person who finds it like 1 drink and they're in the bathroom for the next hour and a half. Like they don't have time, So the other thing with elderly people, and I find this myself too, I don't feel thirsty. They don't feel as thirsty. Okay, what would prompt a person to drink is feeling thirsty normally. Except the fact you have to drink. So when I do nutritional counseling one-on-one, and I will tell people, and I'm going to make sure they drink, make sure you take 2 cups of water before every meal. This is more like a weight loss kind of a trick also. Fill up. Make sure you're drinking. A lot of people will mistake the feeling of hunger when it's really thirst. They'll think they're hungry, but it's actually, no pictures. They'll think they're hungry, but it's actually thirst, okay? If you think back, if you had a good meal and you're hungry an hour later, but you didn't drink, very likely you're feeling hungry because your stomach is somewhat empty from not drinking. Important to drink. It's for all of us, especially elderly. They have a higher, they're at risk for dehydration much more easily. And they'll forget. Not just that's the same way they might forget to eat, they might forget to drink. So you have to remind them, you have to make sure they're drinking all throughout the day. A lot of them can't take a big cup and drink it down the way the young kids do, or maybe even some of us can do it.
How many times a day?
I don't want to say an amount. Usually, just an overall average would be like 8 to 10 cups a day.
Yeah, but older people needs less.
No, I don't think so. And some medications dehydrate you, like they're on a water pill, they'll go to the bathroom. As long as they're not on a fluid restriction, I would say the more the better. You don't want to give them, actually, if an older person has a bad appetite, you don't want to give them too much to drink right before the meal because it will fill them up.
Yeah.
Same reason it's good for weight loss. It's bad for someone who has a very poor appetite. You want them to eat first and maybe drink afterwards. So it doesn't have to be water. It could be tea. It could be a soup. It could be ices. It could be Jello if they find that easier. Fruit.
Does tea count?
Tea counts.
It doesn't count as a
Tea counts.
Can you say the signs of
Very caffeinated beverages, may not count. They, more of a diuretic, but like an herbal tea for sure. If tea is not, very strongly caffeinated, it's fine. Signs of dehydration.
I know we have with my mother when she was tired, and we didn't realize.
Fatigue, confusion.
Right.
Fatigue, confusion. You could tell by their skin. I know when my mother just went for some blood work, the skin color, the skin's a little bit wrinkled looking. My mother just went for some blood work, and they said, I see you keep her well hydrated, because her veins were good. And we're always pushing her to drink. My mother will take 1 sip, then put her cup down, and we'll have to remind her, take another, put the cup back in her hands, drink throughout the day, so that she's actually, at the end of the day, I'm happy if she got 4 or 5 cups. But for her, it works. She's a smaller person. I guess the bigger the person, the more hydration they need also. Which leads to another problem. If a person's dehydrated, you might see they're very constipated. Okay, if an elderly person is constipated, it has so many ramifications. Okay, so many. They're going to lose their appetite. They could be in pain. They could be uncomfortable. They could get nauseous. You have to make sure that they're having a bowel movement. If not every day, then every other day. And this is something that's really neglected in hospitals. I have to say, maybe, if you have a doctor's on top of it, but I know that just besides my own father, with my friends, when their parents are in hospital, I always say to them, if they go into the bathroom, because they don't keep track. They'll go in for a surgery, and they give them all kinds of painkillers, which are very constipating, and they're not keeping track that they didn't go to the bathroom for 3 or 4 or 5 days, and it's not good. So, they need the medication, and again, the same thing I said with the antidepressants. Don't be afraid if they need a stool softener, if they need some Miralax or something to help them go. First treatment is always diet, high fiber foods, fruits and vegetables, plenty of fluids. The fluids are, if a person is eating a lot of high fiber foods and not drinking at the same time, you're stuffing yourself up. Okay, you need to drink with the high fiber foods, so you need to do both. So you really need to make sure that they're very well hydrated. I don't want to say it's equal to eating, or maybe it's equal. The drinking and make sure that everything's flowing properly is very another way of dehydration. If you see the urine is very, very discolored or has a bad odor, that means they're probably dehydrated.
Also, just anecdotally, we found that whenever my father was getting dehydrated, he would get more confused.
I said that, confusion. Confusion is definitely something that comes with dehydration, definitely. Okay, and again, many medications will also dehydrate them. Not many, some. Okay, but on the flip side, diarrhea, the very big problem also, not just for elderly, for everybody. Chronic diarrhea, even acute diarrhea, they're handled differently. Is also very nutrient depleting. It could cause dehydration. If a person has chronic diarrhea, they can become dehydrated. So I actually I went especially to look, a few different things up. So again, if they have chronic diarrhea, they need fluids. Okay, they need to replace the fluids they're losing in the diarrhea. Now again, you want to be careful when you're giving someone in the middle of a diarrhea, acute attack. You want to do things like clear liquids, tea, ginger ale, apple juice, chicken broth. Okay, foods that are easy to digest, low fiber foods. They probably all heard about the brat diet. We do this with babies and kids. Bananas, rice, applesauce, tea. But then you can progress them onto mashed potatoes, toasts, crackers, maybe egg, fish, before you go to something heavy. Don't do anything greasy or fatty in the middle of someone's, acute diarrhea attack. Again, smaller meals. Avoid spicy, avoid gassy foods. Broccoli, cauliflower, carbonated drinks are very gassy. They produce a lot of gas. Beans. Sometimes you have to avoid milk and milk products during the acute phase of the diarrhea. It could aggravate it. If the elderly person, and this goes for all of us, are on a long-term, any antibiotics can cause diarrhea. Okay, so you want to make sure that if they're on antibiotics, you want to give them the probiotics. Acidophilus, Culturelle. You just walk into any drugstore, they all have it already. You don't have to go to a health food store anymore. Everybody's got these probiotics, which you can even give them on a regular basis. We give my mother probiotics on a regular basis just to keep things, even. If there is a lot of diarrhea, by the way, you might have to replace some of the potassium that's lost. Doctor might forget to tell you this, because they're focusing on the heart disease and the burden. They're not focusing on on the diarrhea. They're not worried about that so much. You can give them bananas, potatoes. These two foods are easy for elderly people to eat, and they're higher in potassium, just to put back the potassium into their blood. Okay, another point, if you want to really be careful with elderly people is the bed sores, the pressure sores, the skin integrity. This could be fatal. And a lot of people in hospitals that go in for terrible illnesses, they'll die of bed sores before they'll die of their illness. Okay, so of course, first line of treatment is make sure they're being rotated all the time. If they're in the hospital, or if they're home, and they're kind of bedridden, or they don't move around much, just sitting, or they have to be on all different sides. Get the right mattress. Okay, we got a hospital mattress, an air mattress. Someone has to be checking their skin. If not you, then if you have an aide, someone has to be checking their skin, especially, in the area where they sit and where they lay, and their backs. So make sure that their skin is not broken, no skin breakdown. And someone who is not nourished properly will definitely be more prone to getting bed sores. Okay, so the treatment, of course, you need aggressive treatment once it gets into the stage, there's a few stages. I don't know if they're called stages or something else, but there are different stages. And just, if it's just the beginning of it, you want to make sure they have enough protein for skin buildup, enough B vitamins, zinc, and vitamin C. Those are the vitamins that I always, use for skin healing. It's the B vitamin, like a good B vitamin, like a big vitamin C and zinc. This is for wound healing, skin integrity, and protein. Okay, so if they're
as a supplement or in their diet?
As a supplement. Okay, as a protein you can do in the diet. Make sure there's enough protein. Again, if someone's eating poorly, you might want to they have these high protein drinks that you might want to consider. You feel they're not eating enough of protein foods, which are the meat, fish, chicken, eggs. They're not doing that, they don't like it, or whatever, they can't tolerate it, then give them a protein supplement.
Just a question about the boost. Does it make sense? We found with my mother that the boost that was the highest calories did not agree with her, that it gave her diarrhea.
Well,
does that make any sense?
Yeah, because I don't love a lot of these supplements, only because they're very high in sugar, and they're also very high in fat, because in an 8-ounce can, you're getting 250 calories, and if it's Boost Plus, you're getting 325 or 340 calories. So imagine, how are they making this drink so caloric? They're putting in fat, and they're putting in a lot of sugars, So not everybody can tolerate that. It's very
just give it
heavy
a
on your
minute.
system. I would say if you can, make your own high protein drink. You could take a blender and you can put in things that you can do it yourself, and make your own high protein drink. But for those who can't do it, it's there. And sure, they use it in the hospitals. Besides that, a lot of people don't like it. It's very, very sweet and, but even if you use it and
Maybe
dilute it with
that-
milk or
that is
dilute it
it,
with
yeah.
something else, right? And serve it chilled. Like people don't like it room temperature. It's very rich. So you could dilute it with water or even milk if they can tolerate milk. A lot of elderly people can't tolerate milk and milk products. They develop a lactose intolerant. This could happen in midlife too. People become less tolerant to milk and dairy. If that's the case, they need a calcium supplement. I'm not big on supplements if you can get it all from your diet, but if you can't get it from your diet, you have to supplement it in some way. And now, just watching, they're doing a lot of blood testing, a lot of people for their vitamin D levels. I don't know anybody that came out with a normal vitamin D level. D. I said B? D.
No, they're also doing B, a lot of B.
They're doing Bs too. Not on typical blood tests, if the doctor will check it
Yeah.
off, but they're checking D like a routine now. And they're finding out that very, very, very many people, almost all people, are deficient in vitamin D. Whether it's because we don't get enough sunlight or we don't eat enough dairy products, the D is in the milk. A lot of older people do need a D supplement, and I do give my mother a D supplement, not a mega supplement. It's a 2,000 IUs a day, and that's a pretty decent amount. But do use supplements if you feel they're not eating properly and they're not, getting it from the food. Then that's what the supplements are for. Again, it's better to get it from food, but if you can't, please use the supplements. Okay. That's really what I wanted to cover as far as the elderly person, and then I want to talk about the caregiver. I did want to say, just again, and we talked about malnutrition again. That is very common in the older population, especially when they're in hospitals. Very common. So please do make sure that they're eating their meals. And malnutrition will lead to higher death rates, longer stays in the hospital, and increased risk of infection. Anemia. Again, if a person's not eating properly, they'll become anemic. What are the signs? Paleness and fatigue, which can be confused with a million other things in the elderly. You can never know, but it doesn't hurt to try giving them an iron supplement or giving them food that high in iron, like an egg, and some red meat once in a while to see if it helps. Or they might need an iron supplement. If persons are really anemic, they really need an iron supplement. Again, check with your doctor. Whenever you give a supplement, by the way, I don't want to say this like carb, but you have to check with the doctor. It may interfere with something else that they're on. You don't want to do anything without checking with the doctor. I tell people to check with their pharmacist. I think the pharmacists know better. And my friend called me back. Can I take a leave and motion at the same time? I said, ask your pharmacist. Why are you asking me? Ask the pharmacist. They know. People know. Okay.
So don't go to a different pharmacy. If they don't know, you should be in a different pharmacy.
You should. Yeah, your pharmacist should really know.
Russo is fantastic. Anyone in Far Rockaway, Russo's pharmacy. I'm not getting paid for it, but he will spend hours explaining everything.
In Brooklyn, there's this New Age pharmacy. Jonathan, who's great. New Age on Avenue J, in 29th. That's in But you have modern. You have people down by Coney. There's
Kosher water.
okay. There's pharmacists. Good pharmacists know what they're doing. Okay. So, any questions about what we discussed so far?
Can I ask you to address something?
Yes. How much more time do we have?
We have about 10 minutes.
Oh, and I want to talk about the
Talking
caregiver.
about nutrition for the caregiver.
Oh, that's what I'm doing
Okay,
now.
great.
That's my
Okay.
next topic. Okay. So, let's, I'm just going to read what I wrote here because, being a caregiver can be extremely rewarding, but can also be difficult, both physically and emotionally. And a survey indicates that family caregivers are twice as likely to suffer from depression than the general public. And don't take this lightly. It's very stressful. Trust me. And I talk to my neighbors. My neighbors are mostly younger than me. They tell me how their mothers are taking care of their grandmothers, and they're stressed. It's stressful. Okay, so in order to be a good caregiver, you have to take care of yourself. Your first job as a caregiver is to put your needs up front. not by neglecting everything. Just remember that you have needs. Also, healthy caregivers are better able to serve their loved ones. Schedule time for yourself. Don't alienate from your friends. Accept help from others, please, and take time off. You know, like my friend was watching, unfortunately it was her husband who was very sick and dying, and I kept saying, can I sit with you? No, I don't want to bother you. Like, come on. Like, I went in, you go anyway. You know, people need company. They're spending hours and hours and hours and months sometimes in the hospital. You know, just in terms of helping other people, like be there for them, cook for them, you know, and for yourself. When someone offers it, they know you're staying with someone in the hospital, be it any family member or a friend. Someone offers to make you dinner, say yes, thank you, that would be wonderful. Like, take it. You need to come home to a good meal. You know, don't be afraid. Sometimes we have to give help and sometimes we have to take help. And that's just the way it is. So stress of any kind will impact your eating patterns, okay? So, especially if you're taking care of someone, especially in the hospital, you don't have time to cook. Forget about sitting down and, you know, eating a good, healthy meal. You know, what happens is a lot of people, and I'm going to quote what you said to me, will sit in the bigger Cholim room and have their kokosh cake and their coffee 5 times a day.
Room, 60 pounds later.
It's wonderful, the bigger, but you know what? And I think a lot of them do have healthier alternatives too, but you know, if all they have serving is cake and coffee, then take something for yourself. Think you can grab something or buy something, go to the cafeteria, make sure you're eating properly. Don't live on coffee and cake for 6 months. I mean, you're gonna, besides the weight, it's just, you know, you're not nourishing yourself. Okay, so also, like, a lot of friends, they want to comfort you, they want to help you. They're going to give you ice cream, they're going to give you comfort foods, like a good sandwich, a bowl of soup. This is what you really need, you know. Bring me a salad, bring me a fruit cut up, you know, this is what you really need. Okay. So again, if you don't have time to sit down and eat that big meal, grab a few healthy snacks with you. Take a bag of nuts, you know, take a bunch of fruit, take some cheese. These are things that are very easy to grab and take along while you're sitting there. You don't have to sit there and make yourself like this, you know, gourmet meal, but you can take foods that are easy and throw them in your bag so that while you're sitting there throughout the day, you have what to eat. Okay? Make sure you're getting your fruits and vegetables. And do not drink coffee after coffee after coffee or juice. They offer you, every time they come around to the room, they're offering you juice. And these things are really empty calories. You know, you want to really try to stick with water as much as possible and just eat healthy foods. If you're having trouble sleeping from the stress, a magnesium supplement can help. 400 to 600 milligrams of magnesium is a muscle relaxer, so you don't have to go to like the drugs. Try this first. Again, check with your doctor if you're on medications, but generally it's pretty safe to take, and it does help some people sleep better and relax. Magnesium. Melatonin's good, tryptophan is good, but you know, magnesium's also good. Okay, so you do really have to take care of yourself. You know, if you're not going to take care of yourself, then, you know, if you fall apart, who's going to take care of your loved one? And that's, you know, really, it's all around. It's eating and exercise. And my friend told me when I was speaking, this is my friend who unfortunately stayed with her husband in the hospital. She said, very often you're in the hospital with a loved one and they'll say, okay, they're coming in to do a sonogram. Could you please step out for half an hour? She said, tell them to go outside and walk around. Go take a walk, get some fresh air, get some exercise, move your bones, you know. Like, that's part of taking care of yourself. You know, you're not taking away from your loved one if you're going out for half an hour. Instead of sitting in the Bikur Chol and eating cake, go out for a walk. Or go to a restaurant and buy yourself something to eat.
Especially if you have a cell phone, they can find you as quickly as if they would open the door and say, I need you.
Right. You need to get out there and you need to, you know. So now I'm open for questions. If anybody has any questions.
I want to thank Mrs. Turk for agreeing to come and speak. Does anyone have any questions or comments?
Yes.
Gentleman in the back.
Any strategies on getting elderly parents to eat when they don't want to? If I'm not hungry, I don't want to eat. And you practically try in front of them and they say no.
Yeah, it happens. I find that like the most stress producing. Like, if you know, my mother will say, I'm not eating hungry. I ate already. I'm not eating supper. Like, I don't want. So you can't force feed, you know, but you can really, sometimes I find that just getting in that first one, same thing I tell people with their children. Like, sometimes getting in that, you might not force feed, but you might kind of push that first 2 bites. They see they like it, and they'll eat it. You know, I would even get desperate sometimes and offer her cake. You know, just have some cake, like have something in you. You know what?
It doesn't work anymore.
But it doesn't always work. So, you know, these are the times when you either want to rely on again, they might refuse the drink also. Like, it's okay if it's happening once in a while. It's not something to get stressed about. If they're generally eating and once in a while they refuse, it's what happened in my case. So she won't have supper tonight. She's obviously not hungry. But if it's happening a lot, then you do have to worry that they're not getting enough, and you might, worst case scenario, they might need a feeding tube if they're refusing to eat all the time. Worst case scenario. First you try. That's like the last resort.
Well, I'm just going to add, I cared for my mother-in-law at home for quite a while. One thing that we found was if she didn't want to eat supper with us that night, the next day I would invite one of my grandchildren to come for an early supper with Amma. And she was like, I said, Amma, you're hosting it. She was like so excited. So she ate a quarter of a grilled cheese sandwich, but at least she ate something.
Right.
And that was,
but you remind me of something else. So sometimes when you wait till like they're too tired, like supper should be when they're not exhausted. Then it's, when you're so exhausted, like it's hard to eat sometimes. Sometimes that's the best time to eat, but depends who, But like they love to eat when they're tired. But some people like elderly person, they're tired. Like it's an effort. So, supper time might have to be earlier, or try to concentrate the better meals in the beginning of the day. A really good breakfast and a really good lunch. So if they don't eat supper, okay, like at least maybe they'll have a bowl of soup even, and I'm happy, like concentrate the better meals when they're the least tired, when they're most alert. I find like breakfast and lunch is usually their better meals.
And I also found that right after PT, she had physical therapy at home.
They're
Before
hungry.
she got so tired, she was hungry because she had worked out. And that was a good time to throw some food in.
If there's any way they could do any exercise at home, even at home, even, exercise, walking back and forth, it will stimulate an appetite as opposed to someone who's just sitting all day and doing
and
nothing.
helps with the constipation.
And helps with the amount of walking they're doing not helping that much, but, the more the better.
Any other comments, questions? I want to thank Mrs. Turk. Her card is here.
Oh, here's my business card.
Okay, here's her business card.
Thank you.
If I can give it to anybody.